We are now joined by Dr. Anthony Fauci. Dr. Fauci, thank you for joining us this morning. I want to begin with that new research showing that the COVID-19 may have been circulating in New York far earlier than people thought, mid-February, and that most of the cases came from Europe. What's your assessment of those studies?
Well, I think that's probably correct, George, because, you know, when you had the situation that Europe became the epicenter pretty quickly after China really exploded with their cases. As you know, we cut off the travel from China relatively early, and we were seeded with a relatively few number of cases from China. But very quickly, the epicenter switched to Europe, particularly northern Italy. And given the travel and the air traffic from anywhere in Italy, but also particularly northern Italy, it's just not surprising that, unfortunately and inadvertently, New York was seeded before they really knew what was going on, and that's why they're in the difficult situation that they're in right now. A very unfortunate situation.
Boy, it sure is. And how about those new models now showing that the projected death tolls in the United States could be far lower than we previously thought, maybe about 60,000 rather than 90 or 100,000?
Yeah, that's obviously good news, George. You know, as I've always said, you give models to try and help you project, such as the need for beds, the needs for ventilators, et cetera. But the models are only as good as the assumptions that you put into the model. And one of the assumptions was, I believe, that there'd be a certain degree of efficacy of the mitigation, the kinds of things we're doing right now, that New York is doing intensively. And so when you get new data, the data always trumps the model. So you have to take your data and then refashion the model. And that's what's happened. We've gone from 100,000 to 200,000 down to about 60. That's the good news. What we need to do is to make sure we don't let up on those mitigation, those physical separation programs, because if we do, that can just bounce back again. So even though it's good news and encouraging, we've got to make sure, as I always say, we keep our foot on the accelerator when it comes to the mitigation.
So people who look at these numbers and say, we're going to be relaxing the guidelines come May 1st with about 3 weeks to go, what's your message to them?
My message is that the virus itself is going to determine the guideline. We hope that by the time we get to this extended 30-day period, you know, we went from the 15 days of mitigation to the additional 30 days, which gets us to the end of April. I do hope by the time we get there that we will well see that curve, that bending in the curve, which we've been talking about now for several weeks. There's some indication that that might be going on, particularly in New York. If you look at New York, as Governor Cuomo said very recently, the last few days have had a stabilization and a decrease in the hospitalizations, intensive care, and the need for intubation. You never want to claim victory prematurely. That would be not very good. But when you see those kind of trends, you hope that we'll see that curve go down, and then we could start to think about gradually getting back to some sort of steps towards normality.
Have we hit the peak in New York?
It's tough to tell, George. We very well may be there. You know, when you talk about peak, it goes up, it does this, and then it starts to come down. It's really looking like it's going to make that turn. But, you know, being very careful and cautiously optimistic, I wouldn't want to say that, but I think that is what is going on.
There had been some hope that early on that maybe the virus recedes with warmer, more humid weather. Where is the science on that now?
You know, you should not assume, George, that the virus is going to diminish because of the coming of the warm weather. It might diminish for other reasons. There's precedent with other infections, like influenza and some of the common, more benign coronaviruses, that when the weather gets warmer, that the virus goes down, its ability to replicate, to spread. It doesn't like warm, moist weather as much as it likes cold, dry weather. But having said that, one should not assume that we are going to be rescued by a change in the weather. You must assume that the virus will continue to do its thing. If we get some help from the weather, so be it, fine. But I don't think we need to assume that.
Finally, let's talk a little bit about the new normal after this crisis passed. Handshaking not going to be part of the new normal?
You know, I think at least for a while, George, as I've said, you know, people have kind of raised their eyebrows when I said it. I think we should refrain from that right now because we really need to concentrate on the physical separation, but also, even as you get back to normal, continue to wash your hands, because with viral diseases that are respiratory borne, where people continue to touch their face and then shake hands and touch doorknobs. To me, the better part of valor is just hold off on that for a while.
Dr. Fauci, thanks for your time this morning.
Always good to be with you, George.
Always such good information from Dr. Fauci. And Michael, I don't know about you, I'm willing to live with elbow bumps for a long time.
Yeah, I'm willing to just do it a wave, George, from 6 feet away for quite a while as well.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.